Hi, thanks so much for joining me. I'm Libby Casey with the Washington Post with this special report. As you can see, I'm broadcasting from my living room, and I want to thank in advance all of my colleagues and our tech team at the Washington Post who are helping to make this all happen. Well, here's the latest news from the Washington Post. The House just passed that $2 trillion emergency relief package, and that now goes to the president's desk for his signature. Members of the House had to travel back here to Washington, D.C. and gather together again in the House chamber despite health concerns. And that's all because one Kentucky Republican threatened to hold things up. Meanwhile, the United States struggles to protect its healthcare workers and provide life-saving equipment at hospitals. Overseas, Italy saw its biggest death toll in a single day, and the UK Prime Minister Boris Johnson tested positive for coronavirus. We'll check in with our bureau chiefs both in Rome and London later on in this hour, but we'll start with guests who have the latest on America's public health crisis and that stimulus relief package that Congress has now officially passed. So I'm going to welcome into the conversation my colleagues, Mike DeBonis, congressional reporter. He'll be joining us in just a moment. He's been following everything that's been going on Capitol Hill. Mike, it's great to see you. I'm glad to see you're joining us from home. Thank you so much. So, Mike, first of all, talk to us about the basics of what's in this bill. We'll get into the mechanics of what happened today, but it is going to the president's desk. He does plan to sign it into law. So what should Americans expect to see and when?
So the top line is $2.2 trillion. About $500 billion of that is in direct checks to Americans. Another 370-ish billion is aid to businesses to keep employees on the payroll. Another 500 billion and change is lending credit. It's a credit for larger corporations who need help. And then the balance is direct aid to hospitals, various federal agencies, and all sorts of sundry other things. That are, money that will be doled out by the federal government over the coming months.
We're monitoring questions that people are writing in, and I want to point out that there is a stimulus calculator the Washington Post has created that is so useful. You can find it on the Washington Post website. In that top bar, it's listed as stimulus calculator, because a lot of people are writing in, Mike, and asking what this means for me, and they're giving their various scenarios, like, I'm married with 2 kids, and the calculator is the way that you can figure out what this will translate into. Mike, timeline for the president. What is his expectation? What is the process that has to now happen as this leaves Congress and goes to the White House?
Just some sort of ministerial issues that need to be dealt with. They need to basically prepare the bill for the president's signature. It usually takes a few hours. I wouldn't be surprised if he signs it later tonight, maybe early tomorrow morning.
I'm watching email as we talk, and I just got an email from the White House press office saying they plan to hold a bill signing ceremony at 4:00. So
okay, there you go. Even faster than any of us anticipated.
Yeah. Let's welcome Lenny Bernstein into the conversation. Lenny, who covers health, public policy. Lenny, it's so great to have you with us. Thank you so much. Stay with us, Lenny, while we stick with this questioning for Mike and drill down into this stimulus package that just passed the House today, and the president looks to sign into law quite soon. Mike, okay, the Senate passed it. We thought it was going to be able to get through the House without all the members coming back to DC, which seemed wise because of the obvious health concerns, travel, gathering in one place. So what happened today?
Well, in the House of Representatives, it only takes one member to defy the best laid plans of mice and men. And in this case, it was Congressman Thomas Massie of Kentucky, who's a conservative / libertarian member who's sort of known for being a gadfly maverick. Use whatever words you want. He's frequently uses the small number of procedural tools available to a sole member to make a point. And in this case, he was able to force the leaders of the House to scramble, really, in the last 24 hours to get at least half of the members back to establish a quorum and pass the bill without any procedural questions. Usually in non-controversial bills, the things that have as broad support as this bill has, usually they're passed in a mostly empty chamber under expedited rules. Massie basically blocked that from happening. He made all of these members travel come back. There's obviously a good deal of dismay, if not anger, toward him in the congressional ranks. But they did what they had to do. The bill passed, and here we are.
Yeah, definite anger from members of his own party, Republicans, and also from President Trump, who called him a grandstander on Twitter and said he should be tossed out of the Republican Party.
Yeah, I mean, Thomas Massey is somebody who has actually gone to some pains to, stay behind the president. He was always sort of been grouped in with sort of these libertarian members like Justin Amash, who actually have been pretty critical of Trump, but Massey hasn't really been that way. He's actually been sort of seen Trump as sort of a brother in arms in terms of being sort of the outsider, no business as usual sort of thing. But I mean, President Trump said in his tweets this morning, this isn't a time for grandstanding. We need this guy out of the party. If you can't count on him in a national emergency, when can you count on him?
Lenny, you've been covering what's happening to patients as well as what's happening to hospital workers and this real crisis for adequate supplies. So I want to take you back into some of the stories you've been doing. You wrote about how the Trump administration is just scrambling to offer guidance to hospitals about what to do if they should run out of supplies. What has the conversation been like? What direction are hospitals getting? Do they have to look to their state leadership? Do they look to the federal government?
They have to look to the federal government to get them the supplies they need, but they haven't really been getting the leadership or the material. So it has really fallen to governors like Andrew Cuomo and mayors like Bill de Blasio, to sort of step into the breach and say, we have a catastrophe here, this is what we need, and we're just not getting it. Now, that guidance is being prepared just in case anybody runs out, and the numbers are continuing to go up in places like New York, so it's not out of the question. Right now, the main thing is a scramble for material, for masks, for face shields, for ventilators, perhaps above everything else, for gowns, to just be able to handle the increasingly large numbers of people who are infected.
Lenny, a story you wrote this past week is about healthcare workers, some of whom are resisting their orders because they don't feel like they do have that adequate protection. And you start your story with the man who served in the military and was part of the Marine Force that invaded Baghdad in 2003. So obviously someone who's been through a lot, but he did a 12-hour overnight nursing shift at a medical center in Los Angeles, and it was so bad that he quit. So what are people seeing? What are healthcare workers going through that's so alarming to them?
Healthcare workers. So this guy, he was shot at in Iraq and, did a tour of duty there. He came into work and he saw conditions that he felt would simply almost guarantee that he would get sick. He saw poor infection control. He saw poor screening at the outside of this particular hospital in Los Angeles where he worked. The mask didn't fit. These masks should not only be N95s, but they need to create a seal on your face so that the virus doesn't go around them. And at the end of that, he just said, going back and forth with the supervisors, at the end of it, he said, it's just not worth it to me. I'm going to get sick and I'd rather just leave and not have to deal with this. A lot of healthcare workers are being told to take masks that they would change 2, 3, 4, 6 times a day as they pop in and out of rooms and make those last for 5 days. Now that's just not okay. I mean, no matter how much disinfectant you put on a paper and cloth mask, it is very difficult to make it last for 5 days. So they are going in under conditions that were risky to begin with and are riskier because they don't have the equipment.
So, Mike, what does Congress have to say about this? I was listening to some of the floor speeches today, and they were, a lot of them were talking about how, aid is coming to the American people, and some of them were decrying what medical professionals are having to go through. But what is Congress doing to try to help with this problem?
Well, there's quite a bit of money in the bill that is directed specifically to hospitals and healthcare needs. It was a big centerpiece, particularly of the Senate Democratic messaging. Chuck Schumer was saying since early last week, actually, talking about a quote unquote Marshall Plan for hospitals, trying to get all of the PPE and all of the everything else that they would possibly need in their hands as quickly as possible. Democrats have certainly been pressing the Trump administration to use the Defense Emergencies Act to ramp up production. They've resisted that so far. There are a number of provisions in this bill that are specifically aimed at hospitals. But, our understanding, Lenny's reporting and others, is that, it's not necessarily the federal dollars that are the bottleneck here. It's getting more production online and increasing the throughput here. And that's, the federal government can't necessarily snap its fingers and make that happen immediately.
Lenny, weigh in on that for us.
Well, a lot of the supplies come from places that have already been through the pandemic, China being the main one. And other countries are competing for these supplies. And now we have the states competing with each other for the supplies because the federal government isn't acting as the warehouse or the shipping clerk, as the president put it, or the broker. So there are governors in different states going out trying to get them from the same manufacturers, having to pay top dollar as they compete with each other to protect their healthcare workers.
Some questions that have come in, both for you, Lenny, and also things that you can field, Mike. So I'll start with you, Mike. Here's one. Mary from Tucson is writing in and asking, is it possible to decline or return the $1,200 payment? She says she's a retiree with reasonable resources and she feels that others could benefit from that money more than she could. Have you heard this talked about at all?
I have not, but I can venture an answer, which is these checks are going to be mailed out. Actually, they're going to be direct deposited in your account if you've e-filed your taxes in 2018 or 2019. So there's nothing you can do to stop that from happening. What any American can do is they can write a check to the U.S. Treasury, and the U.S. Treasury will cash it and put it back into the Treasury, but you don't get to direct where that goes. So my humble suggestion would be take that money, and if you don't think you need it, perhaps use your own volition and your own wishes to find a worthy recipient, whether it's a nonprofit group, a local government, maybe. I don't know. There's lots of needs out there right now, and I think that this is a good opportunity for people who are doing okay to pass that on.
And Mike, there is like, there are graded amounts, right? It's not you either get 1,200 or you get nothing. And I learned a lot more about this when I was looking at that stimulus calculator that our colleagues made. And so you can look at your income and how many people live in your household, what your dependents are to figure out, even if you don't hit the exact criteria, you might get some money or you might even get more money. So you can get a sense ahead of time of what you can expect to receive.
Yeah, the rule of thumb is every adult gets $1,200. Every child, the household gets an additional $500. But there is a phase out on the top end of that. So if you're in the upper middle class and up, you're either going to get a smaller check or no check at all. If you're an individual and your salary's $100,000 or above, you're not going to get a check. If you're a married couple filing jointly, it's $189, I believe, or $198. I'm sorry, $198. But there's before you get to $198, $99 or $198, there's a phase out, so it'll be a smaller check up to that point. So use the calculator. We made it for a reason. Check it out. You can find out. The other question is when these checks are going to arrive. A lot of people have said 3 weeks. Kevin McCarthy, the Republican House leader, said 3 weeks today. That seems to be a working deposition. No one is making any promises.
As I was watching the House floor debate and the time for making speeches, Mike, because we shouldn't really call it a debate necessarily. It was just a chance for them to make these 1 minute remarks, 1 minute speeches. Everybody's supporting it, except for Thomas Massey raising some questions about procedure and such. I was seeing, Nancy Pelosi go up to the microphone and like rub it down with Clorox wipes and everything else, which raises a question for Lenny about some of the sanitary steps people are taking. Deborah wrote in from Columbia, Maryland, and asked about this use of hand sanitizers and Clorox wipes. And she's actually wondering something really interesting. Could that create more resistant strains of coronavirus? And if people are able to avoid coronavirus because they're social distancing, does that mean that, Lenny, we might have trouble sort of getting that herd immunity to the disease? Like, are you hearing doctors talk about that sort of long-term questioning, Lenny?
So on the first question, it's a new virus. We don't know. There's so much we don't know about this. Down to even if you get it and then you recover, you have immunity for 6 months or a year or for lifetime. We just don't know. So could we create a more resistant version of this virus? That would be one I would say we're going to have to wait and see. I think just getting through the current pandemic is our priority. Herd immunity almost certainly will develop no matter how good we are at social distancing. The idea being here, for people who aren't familiar, when enough of us have been exposed to the virus and recovered and created antibodies in our bloodstreams, then the herd, which is us, we are now sort of creating a group immunity to the disease, and it doesn't really have any place to live. It doesn't have a host. It can't go into any of our cells, any of our cells and survive. So I think no matter how good we are, this virus is going to traverse the country and probably will create herd immunity down the road.
Mike, tell us about the other unusual steps that members of Congress were taking to protect themselves today. And my last count by the Washington Post reporting was that 4 members have tested positive at this point.
Last I heard was Joe Cunningham, who was 3rd. Oh, right. Rand Paul, of course, would be the 4th. I'm sorry. I was just counting members of the House. So 3 members of the House, 1 member of the Senate. So number one, I was not there, but I was getting reports from my colleagues.
Because you guys are cycling through, right? Because the idea is
I was there all week covering the Senate.
Right.
Paul Kane took the responsibility today. Obviously people were doing elbow bumps and lots of hand sanitizer and all the other stuff, but people were just annoyed to have to be there and have to even take the risk. And just due to the vagaries of the House rules, everyone you had to have 220, 30 some members all had to go to the floor at once to show a quorum. And they did something really unprecedented that we'd never seen before, which is they opened up all of the galleries above the chamber, and all these members really fanned out, not only on the floor, but in the galleries, several rows, seats apart, and tried to really create 6-10 feet of distance between each other. But listen, people were milling around. I mean, they had to get there, they had to get out, they had to pass by people. People were in proximity. So, everyone is hoping and praying that, this does not become an issue, that this was not, in a few days or weeks, we don't see a discernible nexus here that this caused people to get sick.
So Congressman Don Young. Oh, go ahead, Lenny.
Oh, I'm sorry. I just wanted to jump in.
Yeah.
There's a reason they canceled gatherings of more than 10. And you just saw that there in the House of Representatives. That's not safe. And even if they stay 6 feet apart, which is great, as Mike was saying, they have to pass each other. They have to stay there together. Somebody coughs, somebody sneezes. So
they're touching the microphone, right?
Yeah,
right.
It's really unfortunate.
I saw Alaska Congressman Don Young put out a video basically apologizing for comments he made earlier on, joking about the virus and telling people they didn't really need to stay home. So we are seeing sort of a growing sobriety about this. And he even pointed out in the video that it's a special risk to senior citizens, he said, of which I am one. So there's also great concern about some of the elderly members of Congress and just what their exposure, as well as everyone else's exposure, could be like. Mike, before we let you go, just give us a sense of what reporting is going to be like from here on out. So the House is gone now. Till the end of March at this point is the plan. So what's it going to be like for the congressional reporters? Can you guys all hunker down now and stay home?
Yeah, the Capitol is going to be a ghost town, at least for the next couple of weeks. The Senate isn't coming back till April 20th, I want to say. That's when they've scheduled their next votes, and that, of course, is subject to change if the situation evolves.
Yeah.
you've got members talking about what the next bill is going to be, and there's a lot of ideas out there for what could be passed in the future. I mean, it could just be, just throwing more money at some of these same programs. It could be a bunch of other things. So those talks are going to continue at a distance in the next few weeks. No one is really eyeing a particular date for trying to put that together, but I think in about a month or so, that's a real possibility. But otherwise, yeah, we're just going to be keeping tabs from afar and, hoping these guys do as they're told, stay inside and don't cause any trouble.
One last thing, the reason why, if you're wondering why you didn't see some of the images Mike was describing about, the members of Congress sitting in the balconies and stuff like that, that's because Congress controls those cameras. Sometimes people think C-SPAN controls them or journalists control them. We do not. It's Congress, the House, that controls the cameras, which is why we couldn't bring you images of that. We don't even have photographs of it. So that's something that journalists often advocate and push for more access, because I would have loved to have seen, Mike, for one, what that was like, because it truly shows the historic nature of today's vote and the current situation.
Yeah, our best images actually came from members of Congress who were breaking the rules. So thanks, members. We appreciate it.
All right, Mike DeBonis, we're going to let you go and keep the questions for Lenny. A lot of thoughtful questions, Lenny, about this question of being symptomatic or asymptomatic and just how people can pass along the virus even if they don't know it. So here's one from Catherine, who wrote in from University Park, Maryland, and asked, how does an asymptomatic coronavirus carrier pass the infection to other people? If they're not coughing or sneezing because they're not sick, is the virus in their breath? How is that actually happening? Do we know?
Well, just because you don't have heavy symptoms, you cough, you sneeze, you speak,
you touch your face,
you spit, you touch each other. You may not be sniffling. You may not have a fever. You may not feel that pressure in your chest that symptomatic folks complain about, but you are still doing all the things that pass the virus onto each other, particularly touching, shaking hands. Sometimes you leave a virus on a surface and somebody else touches that. Let's say you're on the keyboard and then somebody else is on the keyboard right after you, or on the phone right after you. So there's a million ways, unfortunately, for a virus to spread, and very, very difficult to stop.
Preston wrote in from West Virginia and asked, is the virus airborne?
Virus is not airborne in the technical sense that we use that term. That is usually applied to aerosolized virus, such as the measles, where somebody can exhale and those very fine droplets can hang in the air for hours. Somebody else can even enter the room hours later and contract the measles. This virus is transmitted by droplets. Those are larger particles of exhalation of fluid that come out of your mouth. And because they're heavy enough, they tend to drop to the floor fairly quickly. So to make a distinction, although it's a fairly small one for the average person, it's not airborne, but it is droplet-borne.
Hence that idea of staying 6 feet away from other people.
Correct.
Right? Okay. Ellen and David write in from Long Island. What is known about how long someone is contagious, specifically someone who is asymptomatic?
Generally, people, they're using a 14-day incubation period, and they have been telling us that people should develop symptoms within the first 5 or 6 days. So that's when you can be fairly certain that you will get the virus. But I have read some things that worry me that I'm not 100% sure about, that say you can still shed virus particles long after the 14 days. So up to like 37, I believe. So that's a little bit confusing, and I'm actually hoping we can clarify that. But again, the general rule of thumb is, if you're exposed, you incubate for about 14 days, and you should start showing symptoms in 5 or 6.
Let's talk about New York, Lenny, and what's happening there. And we're tracking, with maps of the United States, just what the hot spots are, just what areas of the country are seeing surges. New York is in a crisis moment right now. So what are you reporting on in terms of the hospital scramble just to be able to get enough supplies and make sure medical professionals have even part of what they need?
Some hospitals are doing okay. There are hospitals that at the current moment, at this point in the buildup, have enough ventilators, they have enough masks, they have enough PPE. Give it a week or 2 weeks, and those hospitals that are currently in okay shape may very well not be. They may be scrambling, they may not have enough ventilators, they may not have enough masks. There are certain hospitals, the smaller and poorer ones, that are already in crisis mode. That is, they are on the verge of not being able to handle the people coming through the door. The staff is stretching and rationing the masks and the face shields and the gloves and the gowns. They are doing things like taking a ventilator that is used for one person and using it for two by putting 2 sets of tubing on it. So there's already a catastrophe in some hospitals. It varies, just like the virus itself sort of hopscotches around the country.
Yeah, I mean, yeah, as you look at states like New York that have rural, really rural areas and also really urban areas, you see why they're saying don't move around, because if you take the virus from some of those densely populated urban areas and bring it to a rural area, you may be taking it to an area that doesn't have enough hospitals and doesn't have enough beds. We're seeing the same thing in the UK, and we're going to talk to Bill Booth later, our London bureau chief, about the real effort they're making in the UK to stop people from traveling around and going out to a rural respite. But we're seeing that in a place like New York State as well. Something else I wanted to have you talk to us about is elective surgeries. And we're all learning about how elective surgeries are essential to a lot of hospitals' business models. So where are things at in terms of hospitals stopping those procedures?
Most have either stopped them or reduced them sharply, but elective surgery is not only in a hospital. You've got these ambulatory care centers where you can get anything from plastic surgery to a knee done. There are endoscopy centers, and they survive based on the money that they bring in, as you said, do other hospitals. And the reason is kind of interesting. They can control that. They know when that person's coming in. They know what the cost is. They know what the payment's going to be. A lot of hospital admissions just come through the ER, and they don't know when they're coming or what kind of insurance they've got. So states and hospitals have been cranking down on elective surgeries. That's as it should be. That's a smart, safe thing to do, but it is costing money.
KS wrote in from Los Angeles and says they think they're recovering from coronavirus, and they were very sick for several weeks with some of those classic symptoms: a fever, a dry cough, difficulty breathing, and fatigue. And they're asking, should they still be tested? And even if a couple of weeks have gone by, would it even test positive at this point? Is there any point?
First, I want to say that there are respiratory illnesses out there with similar symptoms, and so you may not have had coronavirus. But if you live in an area where they're short of tests and they need them for people who they don't know have the bug and may be developing the bug, and you're feeling better, there is some guidance from some people that say it's really not worth bothering any longer. You're hunkering down, you're self-quarantining, you're not exposing other people, you're on the mend. It might not really matter whether you know that you ever had coronavirus.
This question of like recovery and what recovery means, a lot of people have been writing in to ask just what recovery qualifies as. So we got a question from Corpus Christi. Lee asked, what criteria defines a recovery, Lenny?
Wow, that's a great question. Right now, I think it would have to be the disappearance of symptoms. We are not doing the serology tests that show whether your body has created antibodies to the virus yet. It doesn't matter yet. We got to get through the pandemic first. So recovery, the formal definition of recovery may depend on that. Did I ever have it? Did I ever get rid of it? So right now, I think it's simply your doctor saying, you had some very similar symptoms. We tested you, you had it, your symptoms are gone, you've recovered.
Let's bring in Chico Harlan, our Rome bureau chief, who's joining us live. Thank you so much. We saw terrible news out of Italy today that they've had their worst death toll day. What's the latest, Chico?
Yeah, the country reported 919 people had died in the last 24 hours, which isn't just the highest that Italy has seen so far, but any country has seen so far. And this was after 4 or 5 days in which it seemed like the death toll, though it was calamitous every day, was starting to level off. It doesn't track too closely with the question of, is Italy's caseload slowing down, because the deaths tend to lag a week or two, or sometimes even 3 behind the growth of cases. This disease takes its time to kill people, sadly. But what it surely means is that Italy is not over this by any stretch, and that the toll continues to climb tragically.
William Booth is also joining us, our London bureau chief. William, thank you so much for being here. Before we let Lenny go, Lenny, what are you watching from these countries? From the UK, from Italy, from other places overseas, in terms of what's working, what's not working? What questions are you asking, Lenny?
Pretty simple. I am watching Italy every day to see when their curve levels off. It's the worst place in the world, probably at this point. And they are social distancing, they are staying home. And yet, as Chico just said, the number of deaths, over 900, the number of cases, over 86,000. We all want to see that curve start to bend downwards. And when it does, then we can say, okay, Italy got through this in 8 weeks, 10 weeks, 12 weeks. Is that a possibility for us? Now, we've got many different variables, so it won't be exactly the same, but that's what I'm watching.
All right, Lenny, we'll let you go. Thank you so much for all your reporting on this and for answering all of our questions.
Pleasure.
Bill, let's turn to you. So the big news out of the UK today focused on one individual, Boris Johnson, testing positive for coronavirus. So much else, of course, to talk about in the UK, but what do we know about Johnson's case, Bill?
The Prime Minister told us this morning via tweet that he had tested positive for corona yesterday. So he said that he was feeling poorly in the morning, had a persistent cough and some fever, and then he talked with the chief medical advisor about his condition, and then they recommended a test. He got the test, and then before midnight he was positive. It's sad to report that also the chief medical officer has corona symptoms. He has not reported a test yet, but he has fever and he has COVID-19 symptoms. So he's out of pocket and self-isolating. And the health minister here, the health secretary, Matt Hancock, did have a test, and he, within an hour after Boris reported, he reported also that he was positive.
Prince Charles has also tested positive. It raises the question, because we're seeing over here in the States, of course, such a scarcity of tests. How easy is it to get tested in the UK? And then we'll throw it over to Chico for how easy it is to get tested in Italy. Bill, we'll start with you.
It's not easy to get tested in the UK. It's a national health service, and you have to really present yourself at the hospital front door with difficulty breathing and be taken then into a clinic before you're tested. The tests here aren't widely available. It's a bit of a wink and a nod that the leadership is tested or Prince Charles is tested, and it's understandable, right? But tests are not widely available here, and it's a big criticism. They don't have the antigen test, and they don't have really the antibody test in any sort of large numbers yet.
Chico, what about where you are?
More widespread, but not enough. The focus has still been on people who show obvious symptoms, and milder cases go undetected. They don't have the testing capacity, not even anything close. The estimates from not only experts, but even a few folks in government, is that there could be 10 kind of undetected or invisible cases for every one that is a confirmed positive. So that's a problem for even something like what Lenny had been talking about in trying to measure when the curve levels off, because there's not so much trust you can put in the data itself, in the number of positives. And before you take any faith in how Italy is tackling this, the testing has to be more widespread.
Chico, you wrote a story just yesterday about how that nationwide lockdown that was finally being taken seriously by everyone in Italy was starting to pay off. And there was a real question of just, what Italians needed to see in terms of feeling like this was working. And then is there a danger in if confirmed cases go down, not deaths, but confirmed cases, will people start to relax prematurely? Now, today's death toll was certainly, I'm sure, a grim reminder of the seriousness of this.
Right. But wrapped in that, and again, it's an open question about how much it's working and how much faith to put into the data, but the number of cases continues to go down at an ever lower pace. So today was the lowest day-over-day increase in total cases since the outbreak began. That's counting this catastrophic death toll. But that aside, the challenge for Italy isn't just dealing with the medical crisis, it's dealing with the way that this turns into a social crisis, and the economic pressure will only become more acute as people sit on the sidelines, lose their jobs. The clothing store right across the street from us today, the owner was boarding up, taking stuff out. This was reported by my wife, who made the lone expedition outside. But are they done? Probably. There's so many small businesses in Italy, including right in Rome, and these places don't have the stockpiles to continue. So that frustration will build. The frustration of being cooped up will build. And what started as kind of this, okay, let's watch Netflix for a week, turns into maybe one of the most significant forces that will determine government action, not just here, but in other countries too, that will be experiencing sustained lockdowns. From a medical standpoint, there's no reason to loosen restrictions right now, none at all, because the payoff, if the first glimmers of detectability are there, that's not the time to loosen the string at all.
Bill, let's talk about the evolving situation in the UK. We saw an initial resisting to lockdowns, and the UK seemed really like going its own way compared to the rest of Europe, very slow to act on closures. But then it seems like this Imperial College report seemed to change some minds. So what was it about the report? What did it say? And how did it change minds there?
Well, the Imperial College report by Neil Ferguson and his colleagues really got the attention of both the British government and, we've been told, the White House. The modeling, this is epidemiological study, so it's modeling, it's predictive, but not we don't know if it's true yet. But it looked at 3 scenarios, and it said, if you do nothing, like a lot of people are going to die. So if the virus just goes uncontained, you're going to have millions of deaths. If you do kind of what the United States and Britain is doing now, which is you do substantial mitigation, but you don't really shut down society, then you're still going to have a profound number of deaths. The UK is now moving towards the third one, which is really suppression, which will reduce those deaths, they hope, below a figure of like 20,000 in the UK. 3 or 4 times that many, I guess, in the US, if it followed the same strictures and the model held. So that report, that modeling study, really got their attention. It looked at the experience in Italy, where Chico is, and it looked at the experience in Hunan and in China to build the model out. And it's academics like it. It's robust. It's being used. In fact, they put out another iteration today that looked at like 100 more countries. And the bad news there is that countries that are poorly sourced or struggling are going to have a hard time, and they're predicting some large numbers for them. But that report did change their minds, and it did have to get Boris and his team to kind of turn around a little bit.
Well, you filed a story about these urban Brits fleeing the city and trying to go to the countryside, and people in the countryside saying, "Go away, we don't want you here," because they're potentially bringing the virus with them to places that don't have nearly the capacity to deal with the health crisis as a major city would. So what's that tension like? And are Brits finally truly staying home, like at their primary residences, and not trying to make a vacation moment out of this?
I think that probably most Brits, but not all, are staying home. It wasn't unreasonable. I mean, back to the time of the plague, people fled London. They fled the city and went out into the country. And they had city homes and country homes, middle class and upper middle class. Of course, the Queen has several. But they would leave the city. And in this case, people were trying to bug out to the country. Both in their caravan kind of RV campers to go out and park in a parking lot up in Scotland and hunker down, or to just rent a place. You could rent a lovely cottage. It's not really the holiday season. Getting a nice place in Cornwall or for not that much money and spend the 3 weeks there versus in your London flat. And so and there was a minister of parliament from Scotland, like tweeting pictures that place would be blown away with one doctor and one nurse in hours. So the message was don't come, and the Welsh Tourist Board came up with visit Wales period later. And so they didn't, these places that rely on tourism, it shows you how tough this dang virus is. I mean, it kills these places. They want people to come in the Easter holidays, spring break holidays, maybe not college students, but they want them to come, but then now they're telling them don't. It's a bad thing.
Chico, what's travel like around Rome? I mean, around Italy generally, rather. Are you seeing people stopped from leaving the city? Give us a sense of what mobility is like, and who's out on the streets right now. Like, who's actually going out and getting around and doing things?
Almost nobody. I mean, travel is heavily impeded, and enforcement seems to, though it was a little shaky in the first days of the lockdown, it's much more aggressive now. And in some parts of the country, the military is having a hand in it. In Rome, it's police. But I think that by and large, there will always be some bad actors, but Italians have gotten the message. The buses still go by, but they're almost empty. My unscientific sampling from taking the trash out yesterday was seeing 5 buses go by with a total of 2 passengers in the very last seat wearing a mask. And who are those people? They're the ones that need to travel. Maybe they're housekeepers that still have a job, or they are working in a supermarket. These are or at a site that makes something necessary for the supply chain. But by and large, those are the only reasons you're allowed to move. I'm not allowed to leave my house unless I have an essential reason. And that doesn't mean going out to get a fresh breath of air, or going out to jog or exercise or do something other than get drugs that I need for my health, get food that I need to sustain my daily intake. That's it. It's the only reason you can go outside. And Italians not only are putting up with it, but are very vigorous about enforcing it. They really have taken to like shaming people who are out for frivolous reasons. And you feel that.
And COVID-idiots. These are the COVID idiots who are doing what? Tell us about that, how that word's being kicked around in the UK.
Well, that's a tabloid word, but it's an official, it's a ruthless word. And it refers to what Chico was talking about. There's some social shaming going on here, right? So we have a soft lockdown in the UK right now, and even in London. Not as tough as Italy by any stretch, or as tough as Spain. But you're supposed to stay at home unless you have a reason to go out. You're allowed to go out for a jog or a walk or something, take the dog out. So it's looser than Italy. But the COVID idiots are people who run to the grocery store and stockpile the toilet paper, blue paper, as they call it here, or just who don't move on the sidewalk when you pass them by. They're supposed to kind of pass around you. It's the people who closed the pubs down on the last night the pubs were open last Friday. It's like time accelerates here. The pubs were open until Friday night a week ago, so you could go in and get a drink with a million of your mates in the UK last Friday, and they were giving away free beer. And the people who were maybe giving away free beer and packing the pub last Friday, when the infection was clearly spreading out and people were starting to get sick, but are this week's cases. I think those meet the technical definition of perhaps potential COVID. So that's what they did.
What's the perception of Boris Johnson and how he's handling this? There's a lot of criticism here about President Trump, although the approval ratings have certainly gone up in the last little while in terms of what he's saying. And President Trump has not been in step with his own health advisors. He's been sort of pivoting to get more on the same page as them. But as we hear the president sort of fantasizing about getting back up and running by Easter, it's gotten a real pushback from health experts, from politicians, including Republicans here in the US. So how's Boris Johnson doing and how's it being perceived?
Well, if you have a crush on Tony Fauci, you would be very happy in Britain right now. There's a Tony Fauci here and a Tony Fauci there next to Boris every time he mounts the podium and stands at the lectern. So he's always turning left and right, saying, "Well, on the best scientific advice, my medical advisor is telling me, my scientific advisor is telling me." So on that level, you think, well, the Boffins are pretty good. They have Cambridge and Oxford and all these universities here, and they're getting good advice. And I think on that part, Boris is completely different to President Trump in the sense that he's always turning to the left and right and asking his scientific advisors on camera what they think, and he doesn't step on their lines and talk over them, and he doesn't kind of wing it. He has come under a lot of criticism, and this was scientific advice, and also they wanted to keep the economy going, was that Britain was slow to do measures that it could have done earlier to get its arms around this. There was the editor-in-chief of The Lancet, the famed medical journal, was on British Question Time TV, I think last night, saying that basically the government wasted February. That it could have been beavering away at all these millions of things, getting personal protection equipment out to all the nurses and doctors, and really building a bunch of beds and getting the ventilator program going up and running. But it didn't do it. It kept jollying on a little bit, hoping that maybe it would dodge the wave, or maybe squeeze a little bit more out of the economy before they knew that this step was coming. So Boris is seen probably different than Trump, but he had a lot of criticism from some academics, some epidemiologists, and others that they were slow off the mark. Now that's receded into the rearview mirror a little bit. They think the pace is about right, and I think the government's about ready to. Sad for my poor dog who enjoys her walks, but I mean they might turn the screw. Rome style a little bit on us in the not too distant future.
We had a question come in from our YouTube audience asking about if we're even close to seeing the peak of this virus in the US, and health experts here say that we are not at this point because we're still seeing mounting cases. But I'd like to get a sense of what health experts are saying about peak potential in Italy, in the UK. Chico, let's start with you.
I saw something from a few days ago where the WHO, just one deputy director, was saying that it could be, within a week or two in Italy. We're still navigating this for the first time, and Italy is not the first country to try to tackle a major outbreak, but it's doing it differently enough from China that it's a guinea pig for sure. And I wouldn't be really making assumptions that carry much water at this point. And what I do know is that there's been a lot of discussion about how long the restrictions would be in place. And I've heard everything from a few months to through the year. The Prime Minister a few days ago was saying he was hoping that it could be loosened before the end of July 31st, which sounds like an arbitrary date, but it had been rumored that that's how long the lockdown would go. So there's still hope for that. But, Italy is surely the guinea pig for now, just because it was the first to start putting this in place. And, even once we reach this famed peak, it's still going to be a daily disaster. And the potential for it to re-escalate is going to always be there. China has that potential right now, even though it seems to have tamped things down quite a bit. But on day 10, after the peak, Italy is still going to have an incredible amount of coronavirus cases, and the virus will be everywhere. So leads me to think that this is going to be a long-term battle.
Bill, what's the conversation like there in terms of restrictions or in terms of a hopeful peak and then a decline of cases and deaths?
It's a little bit like Chico said, sadly. I mean, we asked the government officials this, the health people and people in academia this every day. They say it's too soon to know. That they're very happy that Britain has taken these measures. One of the deputy medical advisor was asked this question an hour, 2 hours ago at the briefing, because her boss is sadly has but probably coronavirus at home. But she was asked, tell us when the peak is, tell us when it's coming, and she just said, I can't. We're still too early in the curve to give you a date. They're using kind of dates and numbers a little bit like Chico just referenced. Weeks to 12 weeks to summer. They're going forward. They don't have anything definitive yet, and I think they're here a little bit unlike Italy. Is here it's that just little quiet before it really hits. So they're building a second temporary field hospital with potential of 4,000 beds. They're building that now, a Nightingale hospital in the place where they used to have dog shows and Comic-Cons, conventions, and they just announced today 2 more. So you hear 4,000 more beds, 4,000 more beds, 4,000 more beds. It gives you an idea of what they're bracing for. So they don't have an out for us yet. They don't have a peak for us yet.
Chico, one of the stories that you filed that was shared a lot, and I think woke a lot of us up to what was happening in Italy, chronicled the obituary pages of newspapers there. And you've been writing about that, and also just the tragic reality of people not even being able to attend funerals or have any sort of ceremony or recognition when a loved one dies. We've also seen just terrible videos of coffins lined up in places like even in churches. So can you give us a sense of like what the Italians are making of some of these more horrific images and stories, and how you are able to sort of weed through and sort out what the reporting lines and what you make out of all of that as you try to report out and explain the story to the rest of us?
Well, it's terrible because when you die of the virus, in a sense, you disappear. If it's a death taking place at a hospital, you're being taken to a part of the hospital that is, for good reason, sealed off to visitors. And if you have one of these helmet-like breathing devices on, or you're intubated, you can't speak to your loved ones. They can't speak to you. Maybe with the help of a caring doctor, there can be an intermediary making the phone call and relaying messages. But that's when you're still aware. The worse these cases get, they're sedated, they're knocked out, they're on morphine, and then if they die, as thousands have, their families are quarantined or sick themselves. They can't come to the funerals, and that's putting aside the fact that Italy, to keep gatherings at the absolute minimum, has stopped funerals anyway. So people are getting buried or cremated with the presence of 2 people, generally a priest and somebody from a funeral home, in the presence of 2 strangers. And there's, by the way, even a waiting list for that. So it's a terribly lonely side effect of the virus for the family members that normally would have the chance to mourn someone that dies from this. And it is, I think, it's one of the more haunting aspects of the virus. It's not just the chance that you might get sick, it's the chance that a loved one might be taken to the hospital overnight, and then that's it. It's terrible.
Mm-hmm. It's the holy season of Lent, and people, of course, are looking to religious leaders, including Pope Francis. And we saw a very striking image out of Rome, Chico. I know you were tweeting about it. It's Pope Francis praying alone in an empty St. Peter's Square, and he was talking about the coronavirus, comparing it to a storm, and how we all need each other's help. We all need each other for comfort. What is that image? How will that image be interpreted in a place like Italy, Chico?
Well, you know, for Italians, St. Peter's is both like the epicenter of the Catholic Church and a tourist attraction. And if you go there most days, there's thousands of people lining up to go into the Basilica, or on Sundays when the Pope delivers his Angelus, there's often 20,000 or 30,000 people crammed in there. Now, of course, that's been stopped. And there he is in the rain at age 83, missing half a lung, not keeping his distance exactly from people, doing this. And it is quite moving. And in that image, as you see there, it's not just that he's offering a prayer for the virus, it's the juxtaposition of how extraordinary he is doing it in this place that is normally a gathering of the masses, truly of the faithful for Catholics. And it just shows you how much the world has changed, that he is now alone in the middle of St. Peter's.
Can you give us a sense of what people are doing in Italy to find community and to make the best of this terrible situation?
I don't even know. I mean, there was a lot made of the balcony singing at 6 o'clock, which was very sweet while it lasted, but it's kind of, people are realizing that this is really brutal. And it's hard to have a community when you're so atomized in your own house. In our own building, you know, we have neighbors. There has been some interaction at a distance. We have one neighbor who doesn't really, who's kind of not absorbed the mores of the virus era at all, which is almost sweet. But anyway, you know, it's hard to keep your spirits up, I think, for people that are doing this day after day. And there's only the rah kind of only carries you so far. After that, and you know, I've been more and more interested to talk to people who've gone through this in China, because for them it's already been months, and it might continue to be, even though things are loosening. So I'd almost want to hear about the experience of people who've been in Wuhan for that. But it surely is a mental challenge that can't easily be cured with some like pithy advice.
Bill, how are you holding up?
I really reflecting on what Chico just said, because last night in London, for the first time, we all went on the front porch, doorstep, and banged on our pots and pans and clapped, and we wrote about it in today's post. You know, it was a cathartic, nice experience for Brits to do that, to thank their medical caregivers on the front lines, and it was uplifting. I felt personally good, banging on the pots and pans and going up and down the street, trying to interview my neighbors until they ran away from me. But but Chico's exactly right. Like that's very early days kind of experience. They're not singing so many arias in Italy anymore. It's a brutal kind of a thing, particularly up in the north and other places in Italy, and I'm concerned that same thing will happen here. That people are, I guess, gathering strength, right, and applauding the healthcare people. But you know, some healthcare people here, we've seen the photos, are wearing, you know, garbage bags as PPEs. That's not a good thing. Every day there's some new revelation about why they don't have more ventilators, or why don't they have better N95 masks, all this other stuff. And so I think we're still in this lull here. I mean, we've begun to see the numbers creeping up, but the hospitals are not overwhelmed. There's 3,000 available beds in London tonight, in hospitals. Now London's a big, huge city, and they've cleared out everyone who has everything else. So they got rid of all elective surgeries are gone, all sorts of other things are gone. But there are beds, but it hasn't hit like it has in Italy and northern Italy especially. And so I think that's what people are concerned about here. I wouldn't say it's people are taking it lightly. But as I said earlier, they were in the pubs last Friday. They're not in the pubs anymore. And they're building field hospitals in 3 major cities. So it only takes a couple of social media viral videos of there was a great one the other day of some guy who runs electrical wire or phone wire or something around the convention center and just showing that it was like football field size long, soccer pitch after soccer pitch long with cots going up, and people looked at that and thought, holy moly, that's big. So that's where we are now. I think we'll still do some applauding, but then my concern is that we'll be where Chico is in 2 or 3 weeks, where they don't do it anymore out of respect for the dead, which is happening now in Florence. Chico sent us those paragraphs yesterday that they ordered it stopped there because people were in mourning.
Bringing you both some news from here in the United States, President Trump is signing the CARES Act, this relief package, a $2 trillion relief package. And also, I just got an email from the White House, a statement from the press secretary saying that the president has signed a presidential memorandum directing that the Defense Production Act will be enacted. And this is to require General Motors to accept, perform, and prioritize federal contracts for ventilators. So you can see the White House escalating things here, and from the United States front, moving things forward. So we'll be watching those stories as they develop, of course, here at the Washington Post. Final thoughts before we leave you both late on this Friday night, your time, Chico?
Final thoughts? I don't know. What do you think people want to hear about? At the end of the day, sometimes my brain turns to mush, but I mean, it just, as a journalist, it's fascinating to be documenting something that has turned our worlds upside down, but in every other capacity, it's really dreadful. And just learning to live with the uncertainty that we don't know what our lives will look like in a few days or in a few weeks. That's the hard part. And Bill is exactly right in kind of marveling at the way London was a week ago, because it changes so fast, and then every time that people here kind of think, oh yeah, we've got this figured out. We know what the lockdown is. We know how to we know how to take precautions. You realize you don't, so my life might not look that much different a week from now, but in some capacity, it's going to be a lot different. And I think that's true for people pretty much all over the world now, because even when you're just doing the same thing day after day, your understanding of it seems to kind of like change by orders of magnitude at a very rapid pace.
Yeah, Bill?
Yeah, just within the last week, I've been at Westminster. I've been by 10 Downing Street. We've interviewed epidemiologists who are modeling this, and now we're reading their tweets that they are positive for the virus, in addition to friends and colleagues all over the world who are in the same situation. So it comes in on these little cat paws at first before it really smacks you, I think. So we're in this, if I just had to describe the vibe here, it would be that people are sort of waiting and getting a little bit more anxious, day by day. So we're hoping for the best, but I think a lot of the modeling suggests that the UK is going to get slammed pretty decently pretty soon.
All right, William Booth joining us from London Bureau Chief, and Chico Harlan joining us from Rome, our Bureau Chief there. Thank you so much to both of you for taking the time to talk to our viewers and our readers at the Washington Post. Call us anytime, guys. We're here for you.
Thanks, Libby.
You need a conversation. Thank you.
Well, good to see you too.
Anytime. Thank you.
Thanks, guys.
Bye.
And thanks to you for watching this special report. We'll keep coming to you with some more broadcasts. And of course, you can subscribe on YouTube and get notified when we do have videos that we're launching, including like President Bill signing and stuff like that. And if you're not a subscriber to the Washington Post, I encourage you to do so because it will help keep fueling the journalism of people like our foreign correspondents and our domestic reporters here back in the States do. I'm Libby Casey. Thank you so much for watching us. Have a safe and healthy weekend, and we'll see you next week.